A diagnosis of diabetes hits them like a ton of bricks. It just comes at them out of nowhere. They're in total shock. And so in this video, I'm going to outline 8 risk factors for diabetes, essentially 8 things where if you have at least one of them, you need to consider the possibility that you could potentially have diabetes undiagnosed, or you would be at risk for getting diabetes sometime in the future. Before we get into it, I'm Dr. Amina, Goodwin, a physician and a health coach, and I help overweight people with blood sugar problems fix those problems without having to take more medications. All right, so we'll get into it. Diabetes, type 2 diabetes specifically, a very, very common problem affecting over a third of people worldwide, and it's an increasing problem. Whereas many diseases are actually decreasing in prevalence, diabetes rates are actually going up, so in the wrong direction. So what are some of these risks for type 2 diabetes? Well, one is age. The older you are, the more likely you are to get diabetes. Now, diabetes used to be a disease of older people. Young people almost never had diabetes. But now, unfortunately, we're seeing it in young and younger people. But still, age is a risk factor. If you've never been diagnosed with diabetes and you're more than 65 years of age, you should consider the possibility of getting a test just to know where you stand. Second risk factor is a high body mass index, so being overweight. That's more in the news now. There's a lot of talk about all the different weight loss medicines that actually started as diabetes medicines, but having a high body mass index is a sure risk factor for diabetes, because the cause of being overweight is shared by is the same cause of type 2 diabetes. The underlying cause is insulin resistance. So insulin resistance leads to obesity in most cases, and insulin resistance is causing type 2 diabetes, which is why actually the new weight loss medications, Mounjaro, Ozempic, and so on, they are equally as beneficial to overweight people. Most overweight people, as much as many diabetics may be angry because of the shortages that have arisen because of the popularity, but essentially both type 2 diabetics and obese people have the same underlying problem of insulin resistance, and so that's why the same medication is good for both groups of people, and there really and truly should not be any anger, okay? It's just that the obese persons are manifesting more of the obesity as opposed to type 2 diabetes, which might actually manifest in them later down the road if they don't do anything about it. And so when they're taking the Mounjaro and Ozempic and those medicines, they are doing something about it to optimize their health and prevent overt type 2 diabetes in the future, okay? So high body mass index. Third risk factor for type 2 diabetes is having a high waist circumference. So if your waist size is more than 35 inches in women, or if it's more than 40 inches in men, this is broadly speaking, it means that you have more fat deposited in your abdominal area. So not necessarily under the skin and outside the abdominal muscles, but within the belly itself and around the organs, around the intestines. And that type of fat is known to be pretty detrimental to the overall functioning of the body, the metabolic functioning of the body. So if you're finding that your waist is quite large compared to the rest of your body, there's a chance that you could be diabetic or you could go on to develop diabetes in the future, okay? Fourth risk factor is physical inactivity. So just being very sedentary and specifically moving around for less than 30 minutes per day. If you're not active, then you have a higher chance of developing diabetes, type 2 diabetes. 5 is eating few vegetables and fruits in your diet. So you don't have fruits and vegetables every single day. If you're not having fruits and vegetables every day, you have a risk of developing type 2 diabetes, because fruits and vegetables bring with them fiber. And what fiber does is that it mixes with the starches and the sugars that you're ingesting and makes it harder for the body to get to the sugar, and so therefore your body has to work harder to absorb that sugar. It is a slower process, and because it's slower, your liver is not getting overwhelmed, and so you're not ended up producing excessive amounts of insulin, which is the underlying problem in diabetes, insulin resistance, because your body produces too much of it, it stops working well. And so if you're having a lot of fruits and vegetables with all that fiber, you are causing your body to take its time to process your food and to absorb your food, and so it's not as overwhelmed. Additionally, fruits and vegetables come with a whole host of nutrients that feed the good bacteria in the intestines. The fiber feeds them, and also some of the other nutrients they talk about, phytonutrients, that feed the good bacteria. Happy good bacteria produce good chemicals that actually help with insulin resistance and help with inflammation, which also is fat to fire. Adding fat is like adding fat to fire in the insulin resistance problem, okay? Excuse me. So if you know you're not eating fruits and vegetables every single day, then that is a risk factor for diabetes. 6 is taking medicine for high blood pressure. If you're taking medicines for high blood pressure, that's an indication that potentially you're having some of the underlying metabolic problems that give rise to diabetes in the future. All right, so metabolic syndrome, we know, is that syndrome of being overweight and having high blood pressure and having high levels of bad cholesterol and having high fasting blood sugar levels. So having high blood pressure, one of those factors of metabolic syndrome, is a risk for having diabetes already or potentially developing it in the future, okay? Having had high blood sugar levels at any time in your life. If you've ever had high blood sugar levels in your life at any point, it means that your body has struggled. It might have been transiently or temporarily, but that's an indication that at some point you have struggled with controlling blood glucose levels, and potentially you might have had issues with insulin resistance. So that is one thing to look out for. And when I say having high blood sugar levels at any time in your life, it might have been during a temporary hospitalization, something like pneumonia or a heart attack or a stroke, or maybe during pregnancy and it went back down when you had the baby. Just anytime you ever had high blood sugar levels, that is a red flag that, my body has the potential to struggle with processing glucose, okay? And then the 8th risk factor is having a family history of diabetes, right? Especially a first degree relative, which would be a sibling, brother, sister, a parent, mother, father, or a child. If any of these first degree relatives have had diabetes, then there's that tendency in your genes that you could develop diabetes. But I like to say too, more than that is not necessarily a genetic tendency, an inherited genes, but oftentimes it's an inherited lifestyle, an inherited way of eating. And that, more than anything, contributes to development of diabetes in multiple family members, okay? So what do you do? Essentially, the first step to preventing type 2 diabetes is actually recognizing your risk. Like I said, for a lot of people, the diagnosis hits them like a ton of bricks. They just did not see it coming. So if you consider any of these 8 risk factors that I mentioned, even one could potentially convey a risk for you of diabetes, but the more you have, the more likely or the higher your risk of type 2 diabetes, and the more you really want to start looking at what you can do to minimize that risk or lessen that risk. And also you need to actually go and seek testing so you can check your blood sugar levels, not necessarily just a fasting blood sugar level, because that can be perfectly normal even if you have diabetes early in the early stages, because what it is that you might need to check to see what your blood sugar is after meals, right? There's a 2-hour post-eating blood sugar test that can be done. And if not a fasting blood sugar test or a post-meal blood sugar test, you can get a hemoglobin A1C test, which essentially is an average of blood sugar readings over the preceding 3 months, because essentially sugar clings onto the red blood cells, and so you measure that concentration of sugar that clung onto the red blood cells over a 3-month period. And that's the number you're looking for. Sometimes people have access to, maybe they can afford it or they have insurance that can pay for it, but you can actually check a fasting insulin level, which is an even better test, because blood sugar levels might be, all your blood sugar levels might be totally normal, including A1C, because your body is really doing its best to keep everything together. But behind the scenes, you have insulin levels sky high, which is an indication that it has to produce so much insulin to keep those blood sugar levels down. And actually, type 2 diabetes develops only when the insulin cannot do anymore, can no longer keep blood sugar levels down. It starts failing, and then blood sugar levels start creeping up, okay? So fasting insulin levels, thing about diabetes, type 2 diabetes, is that it has no symptoms in the early stages. Everybody knows about the symptoms of being thirsty, peeing a lot, maybe itching, having rashes. But oftentimes in the early stages, there are no symptoms, and then the symptoms might come on so slowly, so gradually that you don't notice, because you just get used to the symptoms because they've crept up on you very slowly. Okay, now a lot of times people really, I recognize that a lot of people struggle financially. There's just no money to get tested, and also depending on where you are in the world. But there are health departments in the United States and in other countries of the world. They're actually public health departments where you can actually go and get tested. Even in America, there are public health departments that offer free testing for people. And depending on what your test results are, you can get obviously education, diabetes education, and even assistance with medications. A lot of times people don't have money as well, but buying medications out of pocket can sometimes be much cheaper than if you have insurance, because there are these special plans in many of the pharmacies where you can get medications for less than $5 per medications. Okay, so there are many resources available. You just have to know that they exist for you. Okay, seriously consider your physical activity levels. Physical activity is important because if you eat and then you go and move around a little, the muscles, which are using a lot of the energy, will use up some of that energy that you just ate, so that you're not having to store it. Energy, you either use it or you store it for future use. Okay, so if you're taking in a lot of energy in the form of your food, but you're really just sitting around and not doing much, you're going to store, and you're going to just store and store and keep storing, and that's how you will gain weight as time goes by. Okay, so I hope you all found this enlightening, and that if you had at least one of these 8 symptoms or signs, you will consider, if you don't have any money, you can go to a health department, and in time for the new year, before the new year, go and find out if you are diabetic, or if you could potentially be diabetic in the future. Quickly, those 8 risks: age greater than 65, high body mass index or being overweight, high waist circumference, being physically inactive, eating hardly any vegetables and fruits, taking medications for high blood pressure, having had high blood sugar levels at any point in your life, even if it was just once, and finally having a family history of diabetes. I hope you all found this helpful, and if you did, definitely subscribe to this channel so that I can reach more people like you who might need to know about this information. Thank you for watching, and enjoy the rest of your day. Bye.